Today, we are diving deep into one of the most incredible transformations in human life, the first 28 days of a newborn. It is just a whirlwind of change, this massive leap from the cozy, quiet womb to the bright, noisy world. So what really happens in those first few critical moments? Let's get right into it.
Okay, so picture this. A baby takes its first breath. The room is full of emotion, you hear that first cry, and right then an invisible clock starts ticking. That very first minute is, without a doubt, one of the most important moments of their entire life. It really sets the stage for everything to come. So what's going on in that first minute?
Well, those first 5 minutes are all about one thing: assessment. Yep, before the first cuddles, before all the pictures, the medical team is doing this super quick but absolutely crucial evaluation. They're trying to see just how well this little person is handling life on the outside. You could say it's their very first test.
And that test? It's called the APGAR score. It was developed way back in 1952 by an amazing doctor, Virginia Apgar. And it's just this beautifully simple yet incredibly powerful way to get a snapshot of a baby's health. They do it at 1 minute after birth to see how the delivery went, and then they do it again at 5 minutes to see how the baby's settling into the world. So how does it work? Well, APGAR is actually an acronym for the 5 things they check: appearance, pulse, grimace, activity, and respiration. Each one gets a score of 0, 1, or 2. So for appearance, being nice and pink all over gets you a 2, but having blue hands and feet, which is super common, gets a 1. A good, strong pulse over 100 beats per minute, that's a 2. A healthy, loud cry for respiration, you guessed it, that's a 2 as well. Then you just add up all those scores. A total of 8 to 10 is considered perfect. A score between 4 and 7 might mean the baby just needs a little bit of help, maybe some gentle rubbing or a little oxygen. And a score of 3 or less means the team needs to jump in right away. But here's the key thing. A lower score at 1 minute is not a reason to panic. It's just a signal for the team to give some support. And almost always, that 5-minute score is way better. All right, so once that first little test is over, a whole series of standard procedures kicks in. And this isn't just about ticking boxes on a chart. Every single step is carefully designed to make sure the baby is warm, safe, and stable as they start their new life.
A really easy way to remember it all is the 4 W's. First up is warmth. Babies are immediately dried off and placed under a special warmer because, they lose heat incredibly fast once they're out of the womb. Second is wipe. The nurses gently clear the airway, suctioning the mouth and then the nose to make sure breathing is easy. Third, weigh. This is where they get all the stats: weight, length, head size. And finally, watch. They keep a close eye on all the vital signs to make sure everything's stable.
Now, one of the biggest procedures right at birth is clamping the umbilical cord. For a really long time, this was done instantly. But now we know better. The World Health Organization recommends waiting for 1 to 3 minutes. Why the change? Well, that little delay allows more blood from the placenta to get to the baby, which gives them this huge boost in iron stores and hemoglobin. It's like giving them a supercharged, healthier start to life.
Within that first hour, newborns also get 2 standard medications. Because they're born with very low levels of vitamin K, which is crucial for blood clotting, they get a quick injection in their thigh. This prevents a rare but really serious bleeding disorder. They also get a little bit of antibiotic ointment in their eyes just to protect them from any bacteria they might have picked up on their way out. It's all about prevention.
Let's talk about something fun. Newborns, well, they don't always look like the perfect babies you see in commercials. They often show up with some unique features that can look a little strange if you're not ready for them. So let's decode some of these weird but completely normal things you might see.
For instance, a baby might be covered in this white, waxy stuff called vernix caseosa. Honestly, it kind of looks like cream cheese, but it's actually this incredible all-natural moisturizer that protected their skin inside the womb. It's so good for them that it's usually just wiped away gently, never scrubbed off.
You might also see something called lanugo. This is this super fine, soft hair, almost like a layer of peach fuzz that can cover a baby's shoulders, back, or forehead. It helps keep them warm in there. And don't worry, it falls out all by itself in the first few weeks.
Okay, now this next one is really important to know. You might see what are called Mongolian spots. These are flat, blue-gray patches, often on the lower back or bottom. And here's the crucial part. They can look like bruises, but they are absolutely not. They're just a type of birthmark, super common in babies with darker skin, and they fade away over a few years.
And what about their head? After a vaginal birth, it's pretty normal for a baby's head to look a little bumpy or even kind of cone-shaped. This is usually one of 2 things. There's caput,
which is just a general swelling of the scalp that goes away in a few days. Then there's a cephalohematoma, which is a little collection of blood under the scalp. The key difference? A cephalohematoma does not cross the lines of the skull bones. Both are basically harmless battle scars from their big journey.
Newborns also come preloaded with this incredible survival kit, their reflexes. It's amazing. If you touch a baby's cheek, they'll automatically turn their head toward the touch. That's the rooting reflex, helping them find food. The Morrow, or startle reflex, is when they throw their arms out if they're surprised. And the Babinski reflex. That's when their little toes fan out when you stroke the bottom of their foot. These are all signs that their nervous system is healthy and working just right.
All right, so the baby's been checked out, they're warm, they're safe. Now what? Now the focus shifts to the main event, feeding. This is the single most important thing for getting the energy and nutrients they need to grow, thrive, and fight off germs.
And breastfeeding is just a powerhouse of benefits, not just for the baby, but for the mom too. For the baby, breast milk is literally packed with antibodies. It's like their first vaccine, protecting them from all kinds of infections. And for the mother, it releases hormones that help her uterus shrink back to its normal size, and it can even lower her risk of certain cancers down the road.
What's just amazing is how breast milk literally changes to meet the baby's needs. The very first milk is called colostrum. It's thick, yellowish, and so rich in protein and antibodies that it's nicknamed liquid gold. Then, after a few days, it transitions into mature milk, which has the perfect mix of fat, sugar, and water to help the baby grow big and strong.
But the big question for every new parent is my baby getting enough? Well, there are a few simple signs you can look for. After the first few days, you want to see at least 6 wet diapers a day. You should be able to hear them swallowing when they eat, and they should seem pretty calm and happy afterward. But the biggest sign? They should get back to their birth weight by about 2 weeks old.
Of course, that first month isn't always perfectly smooth sailing. It can bring a few common little hurdles. Now, most of these are totally normal and they go away on their own, but it's still really important to know what to look for, and more importantly, when to be concerned.
Jaundice, that yellowish tint to the skin, is super common. But the number one thing to know about jaundice is timing. It's everything. Physiological jaundice shows up after the first 24 hours of life, and it's just from an immature liver working things out. But pathological jaundice, which shows up within those first 24 hours, is always a concern and needs a doctor to check it out right away.
There's actually a really cool clinical guide called Kramer's Rule that shows how jaundice progresses. It starts at the head and literally moves down the body. So it goes from the face to the chest to the legs. If that yellow color reaches the palms of the hands and the soles of the feet, what we call zone 5, that's a clear sign that the levels are high and it's time to get medical help immediately.
Now here's something that freaks out a lot of new parents, but it is totally 100% normal: weight loss. Yep, it's normal for a newborn to lose up to 10% of their birth weight in the first few days. It's mostly just extra fluid. As soon as they get the hang of feeding, they'll start packing on the pounds and should be back up to their birth weight by day 10 or 14.
So, we've gone through the tests, the pokes, the weird but normal features, and the first hurdles. But after all is said and done, after all the clinical stuff is over, what is the one thing a newborn truly needs more than any